I think we're going to start, if you're happy with that, Gemma.
Yes, I think so. Go ahead.
We're still waiting for our second speaker, which is Victoria, so I'm hoping that she'll come in a moment. Welcome, everybody. So this is our first in our webinar series for school webinars on the role of different AHP professions. This first webinar will take you through the role of a dietitian, and we have 4 dietitians talking about their careers and roles. And this will be followed up by some information about entry requirements and routes into the profession, and finally some signposting on next steps. Your cameras should be off and microphones should be off for the webinar, and I think that's happening in the invite. But there'll be opportunities for questions at the end of the webinar, so please do write this in the chat as you think of them as you go along. We'll go to the next slide, please. It hasn't moved on for me, Gemma, the slide.
Has it not?
No. Yes?
Others are nodding.
Oh, Marissa, so in ESNEFT, it's not moving on. It's not moving on for me.
No, not for me either.
That's bizarre. It might just be with us.
It hasn't moved for Sharon either. Are you able to move it along, Nick?
I can move it along, but along on my screen. Sharon, are you able to move it along on the bottom of your screen or not?
I can move it on mine.
Yeah, I can move it along the bottom. Yes,
Sharon's
I can. Fab. Thanks, Sharon. That's great. So the allied health professions are the 3rd largest workforce in health and care. And in the main, they are degree level professions and professionally autonomous practitioners. There are 14 registrable titles for AHPs covering 15 specific roles. And you'll notice on this slide there's 16 separate professions. And that's because in the UK, prosthetists and orthotists are dual registered as one profession. There may be some professions that you've never heard of, and if you're interested in a career in health and care and you don't know what yet, I'd encourage you to have a look at all of the AHP roles, because there's something in there for everybody, we think, as AHPs. AHPs provide system-wide access to care, treat, diagnose and discharge patients across social care, housing, education and independent and voluntary sectors. Through adopting a holistic approach to health and care, AHPs can help manage patients' care throughout the life course, from birth to palliative care, so from cradle to grave. Their focus is on prevention, improvement in health and well-being to maximise the potential for individuals to live full and active lives within their family circles, social networks, education, training and the workplace. Within this webinar series, you'll hear about 7 AHP careers, ones that we know we have a shortage of within Suffolk and North East Essex and regionally and nationally. And today the focus, as I said before, is on dietetics. Victoria isn't still on the call, is she, Gemma? So like everything, all of these things can go wrong. So with that, I'm going to hand over to Marissa, who is going to talk about the role of the community dietitian first. Thank you, Marissa.
Would you like me to share Marissa's slides, or Marissa, have you got yours?
You're on mute, Marissa.
Sorry. So I've just navigated onto mine. So I don't know if you need to just forward it for everyone else. It's number 8. Slide number 8 of 16.
Thank you. I've moved along to 8, but if you've got if you're using your own clicker to move through, yeah, slide 8.
Okay, I'll let you know when the next one's up. Okay.
Thank you.
Okay, so I'm not actually a community dietitian by trade, but I have worked in community. So I was asked just to talk a little bit about the role of the community dietitian today. We'll go on to the next slide. So the main aims or the main role of the community dietitian is to provide practical, evidence-based dietary advice that is specifically tailored to each individual patient or client. The aim is to prevent and treat a range of medical conditions through dietary modification and empower people to make appropriate diet and lifestyle choices. So community dietitians see a variety of patients, and to help patients make better choices there. This can include weight management, diabetes, or heart health. Community dietitians also see patients in a variety of different settings, including community hospitals, nursing and residential homes, clinics, group sessions, and patients' own homes. In the next slide. There are different specialities or areas that community dietitians can work in, including diabetes and weight management, nutrition support, pediatrics, care of the elderly, learning disabilities, home enteral tube feeding, and then also long-term conditions, especially things like neurological conditions like motor neuron disease, Huntington's disease, patients who have had strokes as well. Next slide. There's a lot of joint working as a community dietitian, and to ensure the best standards and continuity of care, possibly for patients, they work closely with GPs, community nurses, and other healthcare professionals, especially speech and language therapists in community as part of a holistic approach. They also provide support and training for other healthcare professionals and community workers. This increases knowledge and skills and ensures consistency in the provision of evidence-based information about food and nutrition. I'm just going to talk next slide. I'm just going to talk a little bit about the main areas that the NEECS community dietitians, our team, work in. So we see a lot of patients for nutrition support, which includes giving food first advice. So that's advising patients on using household products to fortify their food and optimize their calorie and protein intake. They can also provide oral nutritional supplement drinks. Care of the elderly, they provide a service for in care homes and nursing homes, giving training to the staff, so that the staff can monitor the patients as well and escalate if anyone seems to be at risk of malnutrition. Home enteral feeding is a big part of their caseload, so it's patients with long-term feeding tubes in situ who need to be monitored and assessed on a regular basis. And this can be either in nursing homes or in the patient's own home. And then obviously, like we said, in clinics, they'll see patients for cardiac health, respiratory, celiac disease, neurology, IBS, allergy, and intolerances. And the next one, like I said, there's a lot of multidisciplinary team working in community. So referrals are received from GPs or district or community nurses. Like I said, there's a lot of close working with speech and language therapy, especially if someone is unable to meet their needs through oral intake, or if a patient is on a modified consistency diet and fluids. The dietitian needs to make sure that the advice they give correlates with what the recommendations from the speech and language therapist. They also work closely with the nutrition support team at the hospital. So, for example, if someone possibly needs to be considered for a feeding tube, a long-term feeding tube, there will be a lot of communication between that team and the community dietitians to arrange that. Also work very closely with the patients themselves and their family and their carers as well, because we try to include everyone, as mentioned, in a holistic approach to make sure we take all the medical, social, medication, all that information into account when we come up with a plan. And it's a lot about working with the patients rather than dictating or telling them what to do. So that's, in a nutshell, what we do. Is that okay?
Thank you very much, Marissa. I'm going to hand over next to Hannah Brigden, who is a newly qualified dietitian who qualified through the apprenticeship route. Hannah.
Hiya, my name is Hannah and I'm a newly qualified dietitian. So I work in an acute setting. So I work on the wards. So I'm just going to just give a sort of a brief overview, sort of how the apprenticeship worked, sort of my experience, and obviously why I love being a dietitian. So obviously there's two routes. So your standard, obviously, after you finish college or whatever you're doing, you go to university. The route that I took was doing a master's apprenticeship. So I had already had a degree in nutrition, and I was working as a dietetic assistant for about 6 years. And then I got the opportunity to do the apprenticeship. So what normally happens is that I had an interview with my department, and then they put me forward towards university. So how it normally works was my week would be split between, so some days I'd be at university, it was all online, and then other days I just would be doing my sort of standard role as a dietetic assistant. I think I definitely recommend doing an apprenticeship. Sort of the benefits I'd say is that obviously you have the hands-on experience, you have support from the experts yourself. So obviously if I had any issues, I'd speak to the dietitians and I'd also get feedback from them. You're also in a real world setting as well. So obviously when you're learning, you then can put it into practice as well. So you're getting a lot more experience in developing your practice. And obviously another bonus as well is that you get a paid alongside studying, which is, yeah, a major thing as well. So as I said, normally when I applied, they asked for obviously for your basics of maths and English. I had a degree beforehand, but they now have brought out undergrad apprenticeship schemes as well, which I think they'll probably touch on in the next couple slides I could see. But yeah, no, I'd say being a dietitian is amazing because not every day is the same. You're sort of supporting and helping people through multiple things. I could be seeing a patient with, that has cancer, someone that has diabetes or Crohn's. Not everything is the same each day. You see a variety of different people, and which has been mentioned previously, you work with a variety of different healthcare professionals as well, like doctors, speech and language, nurses. So yeah, I would really highly recommend doing the apprenticeship if anyone is thinking about it.
Thanks, Hannah, for that. Hannah is one of the first of 2 apprentices in our organisation that have qualified through that route. Thank you. I'm going to hand over to Charlotte, who's going to talk about the role of the dietitian in gastro. Charlotte.
Hello, I'm Charlotte. I am an acute gastro dietitian at West Suffolk Hospital. So I've been here for the past 4 years now. So I suppose in terms of how I got here, so I originally did an undergrad, similar to the previous speaker. I did food science and nutrition. So I didn't really know what I wanted to do. I thought, oh, something foodie. So I ended up going into public health research for a couple of years, which was lovely. But I ended up actually working with a dietitian at the time. And I felt like I wanted to be a bit more patient focused and step away from the research side and get a bit more involved, which is why I'm in acute. So I worked as a dietetic assistant for a couple of years just to check. Then I did my postgrad master's degree in London. And then I came back here, and I've been in gastro for the past three years, I think now, which is lovely. So typical gastro patients that we tend to see in the hospital. So there's a wide range of medical conditions that they might have. Anything you can think of, in the stomachy area. So it might be they've got a bit of irritable bowel syndrome going on and their symptoms are really severe. They've had to be admitted. They might have irritable bowel disease like Crohn's or colitis. And they might need a bit of dietary support to help control their symptoms a little bit. There might be people with sort of pancreas issues, so their enzymes aren't working very well. We might need to step in. We have a lot of liver disease patients as well here. Typically need quite a lot of nutrition support just to help with their liver function and help with their recovery. Let me think. Tends to be a lot of mental health patients, I guess, typically in the gastro wards. just because of their patient groups and the sort of alcohol excess backgrounds as well. And we see a lot of patients just for typical sort of poor eaters. So nutrition support, how can the patients get in a bit more nutrition if they're malnourished and they're really low body weight? Lots of tube feeding. So if the patients can't eat or they've been made ill by mouth, their swallow isn't safe, we might step in to get involved in some tube feeding or artificial feeding through drip feeding. Typically short term, but it can be a bit longer term, and then we hand over to community to step in. So lots of different conditions that there might be in gastro. So what I like about the role is it's very varied. No day is ever the same in acute. You're always very, very busy, which can be stressful, but it's also interesting. And the time really flies. Every day is really, really quick. There's a variety of patients that you can speak to. It's really nice to speak to the MDT as well. Like the previous speakers have said, you know, working in with the patients, the nurses, the doctors, if you need to ask them to do blood tests for you, speaking to speech and language to say, oh, can this patient stop tube feeding now if they're able to eat? And it's really nice, I think, just to see that improvement from when a patient comes into hospital at the beginning, you know, really malnourished or confused on a detox, and then a week or two later with medical intervention and, you know, dietary intervention as well, just helping improve their recovery really, and hopefully get them out of hospital and back into community with a bit of, you know, social support and things like that. But yeah, I think that's what I like about it really. It's very interesting. Would definitely recommend.
Thank you, Charlotte. I think Victoria is on the call.
I am, finally, as long
Amazing.
as the IT holds out.
Thank you, Victoria. So Victoria's going to talk about the role of the dietitian as a whole, and then just talk about the role of the dietitian within mental health. Victoria.
So, we've heard lots about people's various roles already in different areas of dietetics. I work specifically in eating disorders in under 18s, and one of three dietitians in Norfolk covering eating disorders. We also have an ARFID dietitian for the under 18s, so 4 of us altogether, and there are 4 dietitians in Suffolk as well covering eating disorders. As a mental health trust, we only, shockingly, have 1 dietitian based in central Norfolk for the adult inpatients. We do not cover any adult outpatients. We do not outreach to Kings Lynn or Great Yarmouth or anywhere else. We only cover the beds at Helsden and at the Julian Hospital. So somewhat lacking in that. But as a mental health, well, as a role of the dietitian, we are involved in seeing our patients very regularly. We are probably extremely lucky in eating disorders because we have the luxury of an hour-long appointment, which I'm sure some of our acute teams would actually quite value at times, rather than half an hour, 15 minutes, whatever you have in clinic. We have an hour with our patients and we see them weekly to start with at least, and then we tailor it down as they progress. So thinking about dietetics as a whole, we've heard different people speak about their various routes that they've come into dietetics. I came in from a catering background, which was what I wanted to do when I left school. But then I got really fed up of the antisocial hours, but wanted to still do something food related, and was lucky enough to get to meet a lady who had just retired as the head of dietetics for Oxfordshire. And she really was great. She told me all about the role of the dietitian, all the different areas I could go into, all the different things I could do with it. And she's fab. what has come in since I trained, well, I qualified in 1998, and we joined that point. You joined the HPC register as you do now as part of your qualification, and that is a must do. You have to have that HPCP registration to work as a registered dietitian within the NHS or anywhere else that you are calling yourself a dietitian. And you have to keep that registration up to date with regular CPD. That can be through your own work, but also things that you might do outside of work that will count towards your CPD. And that is audited on a random selection basis. So every year, come sort of May, June time, there's a little bit of anxious waiting to see if the letter drops on your letterbox to say you've been picked. Produce your portfolio to show you are keeping yourself up to date. But the CPD is really important. Could we go on to the next slide, please? Thank you. So these are just some of the areas that dietitians work in. So we've got palliative care, diabetes, neurological diseases, nutrition, sports nutrition, women's health, public services, food services, mental health, a lot about sustainable diets that dietitians are working on. And then really going into the more physical health side, the things like renal, gastro, HIV, oncology, so many areas. Just about anything that you can think of, you could probably fit a dietitian into it somewhere along the line. And you can just see from that little lot that there's quite a big broad selection of dietitians working across a number of different areas. Can we go on to the next slide, please? Thank you. So as a dietitian within the NHS, you've got lots of options to specialise. Most people will come in and do a year or two at a band 5, really to reinforce what you've learnt in your degree and your placements and to really embed that dietetic knowledge. And you should in that time hopefully be able to do some rotations so you will get to know different specialities. And that will then lead you on to be able to progress into a band 6 and begin to specialise if that's what you want to do. And you can go on to be band 7s, 8As, consulting dietitians, all sorts of roles. You can go into research, you can go back into education, and you can do much more practical dietetics as well. So leading cookery clubs, if that's your thing, writing cookbooks and articles, and oh, it's just so much. You could go on about it all day. A lot of dietitians that I know also work in private work, and they might specialise. There's a lot that specialise in eating disorders or obesity care who work privately, but they might mix that and do part-time NHS, part-time private. So you can mix those things really well. A lot will go into government or charity work as well because they always need dietitians. Classic example being right now with the earthquakes in Myanmar and Thailand, the relief agencies will be sending food to those people. Do we ever give a thought to what goes into that food relief ration pack? Probably not. But a dietitian will have looked at that and considered what they're going to need to send and whether it is practically possible to send stuff that might require water to mix it, heat source to heat up the water or the food or the milk. All of those things will have some dietetic bearing in the background. The food industry is a massive industry for dietitians. You will find them all over the place within that. They might work for Waitrose, Sainsbury's, Tesco's, Asda, whoever, writing for their magazines and their internal promotions, but they might be involved in the food companies that make the ready meals and all of that sort of thing. So there's masses of opportunity there. And also we're getting more and more dietitians on TV programs doing that broader education, and specifically involved in education for master's programs, graduate programs, children, education for schools, all that kind of thing. So really the world is your oyster once you've got your qualification and got a bit of time behind you, sort of doing your ward work and really embedding that into your practice. Could we go to the next slide, please? Thank you. Really good video which we can play about why this man, who's called Chris, why he became a mental health dietitian. So we've just got that to play. Hopefully it will work.
Hopefully it will work. It's just whether if you're not on the same slide, hopefully you might have to just mute the presentation if it's playing differently to you so you can hear it on your own screen, but I'll play it now.
Okay.
It's not playing for me, Gemma.
At all, or just the sound, Nick?
At all.
Is it playing for everyone else? A mixture.
Playing in West Suffolk. Playing for us.
Okay, so Sharon's sharing it herself. They're playing it themselves. So that might be what you have to do, Nick.
I think it's only a minute long, so hopefully everyone's had the opportunity to watch it.
Yeah.
Victoria, have you got a little bit more to say, like a couple more minutes, or is that you finished? Thank you.
I think that's me done.
Great, thank you very much. Thanks. I loved all of those different places where dietitians work, and I've never ever thought about that. So thank you for talking about that. I'm going to hand over to Nina, who's the professional lead dietitian at West Suffolk. And yes, Sharon, we are going to send out the slides, and this will be recorded so that you can keep it in a bank, and we'll send that out as well so other people could watch it. I'm going to hand over to Nina, who's the professional lead dietitian for West Suffolk, who's going to talk about entry routes into dietetics.
Thank you, Nick. Sadly, I'm not actually the professional lead, but I do manage the community team. But professional lead might not be happy to know she's been usurped. But yeah, I manage the team of community dietitians. So I'm going to talk to you about routes into dietetics. From a personal point of view, I didn't do dietetics as my first degree. I did biology because I had no idea what I wanted to do. And then it was only sort of a year after that where I came across some research about fish oils, and I thought, well, that's really interesting. And then I looked into, well, how could I learn more? How could I just be involved more with how food affects you physiologically and how you could, help people? I knew I wanted to help with people. And then I went back and did a master's in nutrition and then a postgraduate diploma. So I was going to talk about the various different routes. I mean, we've got such a variety of people on the call, and everyone I think has had a different route into dietetics. So you can do a full-time undergraduate. So I think obviously for anyone at school at the minute, knowing they want to be a dietitian, this is definitely probably the most efficient route in. So you could do a full-time undergraduate BSc degree. That normally takes between 3 and 4 years, involves quite a few sort of placements, which is really good because you get that practical experience as well as all the actual sort of research and programs in different subjects to sort of back up your knowledge. And I think there are currently 15 different universities in the UK, so including Northern Ireland, Scotland, Wales, that offer the undergraduate degree. Then the alternative route, if you're not quite sure now, you want to do something else, but you might like to come to it later, would be to do a postgraduate diploma. The key thing, or a master's in dietetics. In order to get onto those courses, you do have to have adequate biochemistry and sort of physiology in your undergraduate degree. So in my case, I did a biology degree, which was purely botany and zoology, and I had no human biology, so which is why I had to do a master's and then a postgraduate diploma. A bit long-winded. So if you're thinking about it now, probably try and look for the most efficient routes. And then obviously we've heard quite a lot about the degree dietetic apprenticeships, which obviously are quite new to us all, really exciting. So we've also currently got our first 2 apprentices at the West Suffolk. Both of those are undergraduate apprenticeship programs, so neither of them have done degrees before. So that's really exciting. Obviously, as I'll talk about in a minute, you do have to have meet certain criteria to get onto those, but it's another really interesting route. And so the link that I've got on the second, bottom half of the first slide here, to the British Dietetic Association website, gives you lots of information about all the different universities where you can study dietetics. The most local ones, and where we get most of our students from, are the University of Hertfordshire. Then there's the London Metropolitan Universities of North London, the University of Surrey. But there are lots more universities up in the Midlands, and as I said, Scotland and Wales too, Northern Ireland. Next slide, please. So I talked a little bit about entry requirements, but in terms of your undergraduate course, of course, if you have an idea which university you want to study in, it is best to double check on that website as to what the entry requirements are. But in general, you need to have biology and chemistry at an advanced level, so generally A levels or national equivalent. Obviously, students are accepted from outside of the UK as well. And that's because obviously those are really relevant subjects to the degree. Other qualifications or equivalent standards may be accepted, so things like the International Baccalaureate, any access courses, BTEC diplomas, sort of at equivalent level. So if you've gone back and sort of taken qualifications later, then those will also be considered. And you would also have to have GCSEs in English, maths and science or equivalent, grade 9 to 4 to 9. That's for your undergraduate degree. For a postgraduate degree, again, that does vary a little bit more. I mentioned about human physiology and biochemistry sort of being a sort of big component of your undergraduate degree if you want to go and do postgrad. And you have to have a good command of spoken written English. And obviously you have to be aware, as with the undergraduate course, before you get registered, that you would have to have occupational health clearance and you'd have to have a criminal records bureau check. And then the final way of becoming a dietitian is to do a degree apprenticeship. So as we've said, that can either be an undergraduate or a postgraduate apprenticeship. In general, the entry requirements would be at least 5 GCSEs, grades 9 to 4, and or level 3 qualifications, including A levels, NVQ level 3 or BTEC. You would need to be in employment, so you have to have a job, and obviously your employer would need to be willing sort of for you to undertake that apprenticeship course. And in terms of then finding the apprenticeship placements, roles tend to be advertised on NHS jobs. So it's not necessarily that easy. So it would be a matter of sort of looking in your local area if that's where you wish to stay. And then seeing what roles are offered. So you will get a post offered. So often when you're being an apprentice, you would probably work as a band 4 apprentice within that trust, and you'd be released to the university for the studying component of your job. But it's a really interesting route. Obviously, as mentioned by Hannah, it's particularly exciting because you do get paid whilst you study, which is clearly really attractive to lots of people. Last slide, please. So perhaps me, like many other people, when I first thought or even learned about being a dietitian, thought, well, it's quite, you know, there is information available. The BDA, I would really urge you to look at, and I've got the link there. But the best way to find out about what it's like to be a dietitian is to go and shadow one for a day. And certainly I think ESNEFT and certainly the West Suffolk Hospital will offer opportunities for you to shadow dietitians. You just need to get in touch and ask. So I've got 2 email addresses there, one for the West Suffolk, so we're based in Bury St Edmunds, and then ESNEFT is obviously based, correct me if I'm wrong, obviously Colchester and Ipswich Hospital, but I'm sure sort of community options, and obviously we've got NSFT also on here, but I think perhaps at the moment they don't offer those work shadow opportunities because it can be a bit more complicated in a mental health setting. But you're very welcome to email either of those, the most relevant, both email addresses, if you would like to come and shadow a dietitian. And obviously the more information about what it is that you want to see, then the better. So you might really be interested in community. I'd love to have you. Or you might really want to sort of see what it's like sort of on the ward, sort of the grimy face of what it's like in a hospital, which is always really interesting. And you might have a particular interest in paediatrics. You might really want to see what ITU is like. You might want to see all of those things. So just let us know when you email what it is you're particularly interested, or you might just want us to say, right, we'll see who's available, and, you know, we'll put you where we think would be a sort of nice selection. But we'd really, really encourage that. And then look at the BDA website. It's got so much information on there about what you might get paid, where might employ you. Obviously, as mentioned by Victoria, there are we're all speaking from an NHS perspective, but there are loads more opportunities outside of the NHS as well. And also, you know, for further on in career, I think a lot of dietitians cut their teeth in hospital, but there are lots of places you can go after that. And obviously within the NHS, then there's lots of places you can go as well. So at the moment, I'm predominantly in management, which is really interesting, and it's different from my clinical career. I spent most of my dietitian life being an HIV dietitian in London, and now I'm in Suffolk and managing community team. But there's lots of other places that you can go, sort of working in things like transformation, project management, quality improvement. So it could be the place that you stay. It could be a sort of stopgap along the way. But I've definitely enjoyed my career to date. Okay, that's me done.
That's great, thank you, Nina, and love hearing everyone's stories and how wide and people's career entry routes have been into it, so thank you. I'm going to go out for questions. If there's any questions for any of the dietitians on the call, please put them in the chat. Give you a minute. Do you want to plug your Instagram account now, Gemma?
Oh, yes, please. For Suffolk and North East Essex Integrated Care System, we have an Instagram account. It's SNE AHPs Can Do. I'll pop it in the chat. I think that'll be easier. And we share a lot of information about all of the different allied health professions, different routes in. There's a lot out there that's really interesting and insightful about all of the careers. And also we try to share some local opportunities as well. So if you're listening to this, please, and you're on Instagram and you want to find out more and stay up to date, please do follow us and look out for our posts about the different AHP careers. Thank you, Nick.
Thank you. Gemma, could you, I don't think we've got any questions in the chat, but Gemma, please could you go back to slide 3, I think. Are you there?
I am, yeah.
Just to finish, so this, as I said before in the beginning, this is the first of our webinars for the AHP careers. They're on the first Wednesday of every month, the same time, 1 o'clock. The next one will be on podiatry, and they're going to talk about the big range of what's available from a podiatry perspective. You'll notice that all of the AHP professions, that the 16 different professions that I talked about at the beginning, are not mentioned in here. But these professions we've selected, we know there is not enough of these professionals in the workforce, both within Suffolk and North East Essex and nationally. And so that's why we've selected those, just to get some of those professions that are less well known and visible to our local communities. We really hope you found the webinar useful, and we look forward to you attending more of the webinar series. Just have a lovely afternoon, everyone. Thank you very much for coming.